they look at these, I can use them. Thank you.
I need all mine. I don't never have enough. I need all mine. I never have enough.
Okay, that's fine.
People ask for them all the time.
Not today. Did I show you that?
It should, what it should have done is gone over to and so.
But then it said, when I hit that
And
time,
that's out of here in a hurry tonight, too.
You're supposed to have an hour.
No, there was no.
But anyway, you would, now they do have some.
Hey, Jim.
They do have some.
turn off the phones.
Yeah, but, you know, since I left you, I had to say that on me. I mean, I don't want to hurt him, but still.
He said, I need to do it to clean it up in case we get sick. He said, sir, I'm like,
Well, it would look. Just about. Everything going on?
We will now call our August 21st County Commission meeting to order. I'm going to call on Mr. Williams, Godfrey Williams, for invocation.
Bow. Heavenly Father, as we come to the close of this day, help us to continue to be mindful of the many blessings you've bestowed upon us. Thank you for the blessings you've given this board and all the citizens of Iredell County. Now, watch over us through this meeting. Give us the wisdom to carry out the duties of the county, and continue to bless us as we always thinking about our soldiers and in other parts of the world. Be with them and their families. Now go with us and direct us in the rest of this meeting. Amen.
May we stand for pledge of allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Call on Mr. Mashman for adjustments to the agenda.
Mr. Chair, I have the following adjustments to the agenda. Under Administrative Matters, add item AA, a request to call for an election on the question of creating the Troutman Fire District in accordance with GS 69-25.1. Add item O, a request to approve the funds availability form requested by Mitchell Community College. Item P, approval of a burning ban as recommended by the County Fire Marshal. And Mr. Chair, under unfinished business, the motion to approve findings of fact for case 0703-1. Mr. Chair, those are the adjustments to the agenda that I have.
Okay. Do we have additional adjustments?
I got one question concerning the finding the facts. It was stated in here this was a SB district. Is that correct? CB district. I thought this was an M2.
It is an M2 district.
Okay. So that needs to be corrected then?
Okay.
The earlier draft had M2. I don't know what happened.
I don't see it as a CB.
The handout you.
On the handout you gave us, it was CB.
Under item 1.
Community business.
Shouldn't be. Does it have 0703-1 on the top?
Yes, sir. The draft we got says, this is true, the applicant has requested uses that are allowed in the CB Community District, Business Zoning District.
This is not what you submitted earlier, Ron. I don't know.
I'll go make copies of this.
Yeah, I don't know.
I'd request we pull that then, and if there's another, if we haven't seen the document, I hate to approve it till I actually read it.
Well, I mean, it's going to be presented in unfinished business, but this was not the document that he presented earlier, and I'm not sure where this, came from.
Okay.
I think we'll have ample time to address it.
Do what?
Okay.
Okay.
Hit the wrong one. He's hit the wrong button.
Yeah. Are there any additional questions regarding the agenda or additions? Okay. If not, do I have a motion to approve with the corrections?
So moved, Mr. Chairman.
Okay. You heard the motion? Any questions regarding the motion? All in favor, vote aye.
Aye.
Aye. Those opposed, likewise. First item on the agenda tonight is appointment before the board by Mr. David Swan. Thank you, Mr. Swan.
Thank you, Mr. Chairman. It's good to be with you all tonight once again. As I mentioned 2 weeks ago, Crossroads has been providing services in Iredell County now for 10 years, and 10 years ago I did not wear glasses, so a lot of things have changed in addition to the mental health service system as well. I provided you with a handout prior to the meeting that I think the clerk has been able to get to you last week, and as well tonight I have placed several other items stapled together which are led by a colored map of North Carolina at your place that I'm going to refer to and just point out. I'm going to start with the item that was in your packets that you probably received by mail. Just as a refresher, Iredell County, the population, according to the State Data Center, July 1st of 2007, is 150,787 persons. This is significant because the combination of our population among the three counties that Crossroads serves meets the North Carolina General Statute's minimum requirements to be a local managing entity of 200,000. Our total population is 262,212 as of this summer. And I provided for you a 6-year history, including this current fiscal year, of the appropriations that have been made by Iredell County going back to the year 2002-2003. You'll notice that in 07-08 you approved $515,354 to Crossroads in appropriation. And, of course, we use that to provide services here in Iredell County. The Iredell County person served, there is the fourth item down. In this last fiscal year, 2,271 people were served here in Iredell County. That is 43.9% of the total people that we served with state and county funds throughout our 3 counties. Now, there's a note there, if you've been practicing this with me as long as Ms. Tyson and I have, then you also know that those numbers several years ago were much larger, and that is because Medicaid was captured in that data. 2 years ago, Medicaid was removed from the management of all of the local managing entities in North Carolina, and so you can nearly double that for Medicaid. Medicaid has been and continues to be about 45 to 50% of our business. So there is a whole nother group there that I don't have exact numbers on because we don't have the data to collect there anymore. Our annual budget I've put there also for you. Next item down is $26,998,176, which is an increase from $26,200,000, and that is the result of several grants we received, Medicaid and CAP Medicaid pass-through, and some additional money to support psychiatry that we received from the state of North Carolina. We have not received our allocation letters from the state yet, so we do not know exactly how our budget will look, but this is what our board has approved so far year to date. I have provided to you, and you've seen some of this before, but as the next item, a listing of local managing entity functions. There are 7 of those. It should be the 3rd page down in that first group that you received by mail. I'm not going to go through these because you largely have seen these before. However, I just want to point out that the North Carolina General Assembly enacted some legislation this year that modified in small ways some of these functions, and I have included those in this. So if I have given you this last year, which I'm sure I did, it is more up to date this year and consistent with the general statutes. Several bills were ratified this year that were big, large for our community and good for mental health and good for the citizens of Iredell County. 4 of them I just highlight, and I've written a sentence about each of them for you. House Bill 628 was an act to create a uniform co-payment schedule for mental health services. Across North Carolina, each of the programs had the option of charging different sets of co-pays. So if you, from Murphy to Manteo, you may pay a very different rate depending on your eligibility with your income and number of dependents. The General Assembly this year decided to standardize that, and we are, of course, very appreciative of that. So it was very hard when people would move or relocate from one part of the state to the other, and they would find out that they were paying less or more. Of course, they might have been happy to pay less, but when they have paid more, that was a problem. So it's still not much money, but it's a small contribution to their service. Session Law 2007-973 also is something very big for North Carolina. I believe we've been trying to get this for 20 years, the General Assembly, so I have been after this one for 20 consecutive years, and that is to get mental health parity in the insurance market for behavioral health services. North Carolina had never had a mental health parity bill, and all attempts at getting such a bill had been stopped usually halfway through an assembly. So this year it was signed, ratified, and we're very happy about that. So it requires parity among insurance products for persons with mental illness and some limited amounts for certain mental illnesses that are not too severe. House Bill 627 was another act that changes and strengthens local managing entities. That's the one where they refined the 7 functions and also added a number of other things there. So again, I just refer you to that 3rd page. And then finally, Session Law 2007-323, which is the appropriations bill. And here is where we have the different kinds of money that are going to be coming to mental health this year. I just highlighted one of them for you. There's several in there, but a pilot project that offers financial incentives to reduce State hospital usage is in there. This year, it's $2.5 million this year, $5 million in the second half of the biennium. With that money, 4 LMEs in a competitive application would be selected to be able to receive that money and start local services that would help to keep people closer to home. Also, I'll just mention a small amount of new money also in crisis services that we will use to help support our crisis center here in Statesville. There is a financial summary in the second packet of information that you had tonight. I didn't have it as early, but I'm going to refer to that in a minute. I'll just keep going through this document, and then we'll get to that second one. If you turn over to page 2, you'll see the summary of visits by Iredell County residents for the 06-07 fiscal year. You'll just see there that those are divided in 5 different groups to make it easier to understand. There's clinical office visits, crisis services, evaluations and screenings, rehabilitation services, which is where we do vocational training and also long-term rehabilitation care for people, and then residential care, which is housing or group home services for adults and children. Each county, through a local managing entity, must submit a local business plan according to the Secretary's rule and according to the General Assembly as well. That time, this is only our second since 2002, but it was time for us to submit that again. I actually brought that to you last winter. You approved that, and I'm happy to tell you now that the Secretary of DHHS has also approved that. It's on our website, and the web address is there for you. Also, Mr. Mashburn has a copy of that. Under crisis services, I want to show you a little bit of a slides here in this same packet again about some things that are going on. First, the crisis center that, of course, is down here in Statesville has reopened on January 15th of this year. It was closed for 6 months last year, as you might remember, after one provider left, and the department declined to give us permission to provide that service for very long, so we couldn't get into it and then get out of it real fast. So we had to search for another provider. It took us 6 months to find one, and we were able to start it back up in January, and so that's going along well. Also, we added mobile crisis services. I'm going to get you to turn over to the last 2 pages of that packet that I'm referencing now, actually the last 3 pages, and you'll see something that says Mobile Crisis Management Team for Crossroads Behavioral Health Care, an annual report. Just going to reference a few slides here that may give you some idea about what's going on in the community. This is probably one of the best things I have seen in mental health in maybe 8 or 9 years. That's service to people. It is a mobile team that has a psychiatrist, nurse, counselor, technician, social worker that goes to where a person is in crisis, no matter where they're located within the county. That can be their home, a nursing home, an adult care home, a hospital emergency room, anywhere they are, even a bridge, that's where this team goes. It started last summer in the month of July, had a little bit of a slow start because we're having to fund it in a special way. It's hard to fund something like this because you're really paying them like a fire department. You're paying them to be available, and it took a while for it to catch on. But 430 crisis events were provided this past fiscal year. And I've got them divided here on the second slide. You'll see 44% of those were Iredell County, 45% of those were Surrey. Now that's interesting because this is driven by people either contacting us or law enforcement contacting us or hospitals contacting us. And so it was almost even between those 2 counties, but as you know, Iredell County is really a little more than twice as large as Surrey County, but we had a lot more contacts come from Surrey per capita, and then, of course, a smaller amount from Yadkin. If you go over to the next page, you'll see in the top slide the presenting problems, the top 6 presenting problems of the 430 people that we serve through there. You will actually see the breakdown from 77 for substance abuse, 75 for depressed mood, 30 for hallucinations and delusions, on over to 115 for suicidal ideations and threats, and 30 for suicide gestures and attempts. You see, this is not your garden variety, low impact type of service. These are fairly serious people. The next slide's real important. Look at the 430 and then see that 103 required law enforcement intervention. I'll tell you that I believe tonight that of that 430, had this service not been there, more than half of those would have had law enforcement involvement. And in fact, a lot of the 103 were law enforcement involvement where the staff were concerned because when they asked them on the telephone all the way to the place, wherever it was, if they had a weapon in the house, they answered yes. So we called the Sheriff's Department, and the Sheriff's Department sent an escort. So it didn't turn into an involuntary commitment with the transportation down to the hospital at Morganton, and it didn't turn into anything heavy, but largely a lot of those 103 law enforcement involvements were protection for the patient and protection for the staff. So we really think that was a big savings for the county. And then outcomes. Out of the 430, 100 of those people were hospitalized, so 330 were not. It's also our belief that if those folks that have shown up in the emergency room of a local hospital, they probably would have been involuntarily committed to a hospital somewhere, which would have then required Sheriff's Department transportation. Which you see from the mobile crisis event, again, 70 to 80 some were admitted to the Crisis and Recovery Center. And again, that was only during the 6 months that that center was open, beginning in January. But look at the next bar. More than 220 were returned to their home after mobile crisis served them. Mobile crisis can stay with the patient 23 and a half hours in their own natural environment managing the crisis. So they don't have to go to the hospital sometimes, and they don't have to go to the crisis center. In other words, we're keeping these folks within their natural environment. And then one of those 430 was arrested, and that represents that last bar. If you will, let me go to this packet now with these. Let's see, did I finish that? Well, let me just back up. I'm sorry. I was going to mention the consolidation activity and then the services and locations just briefly. We've been talking about consolidations among local managing entities, and the first picture that I have for you is what it looks like on July 1st. Since I have been with you the last time in a formal way, we had 30 local managing entities in North Carolina. As of July the 1st, we have 25. 5 of those dissolved at the end of June and merged into some other programs. We are, as I say here, we are not in any active discussion with any merger, partner, or consolidation. We have been in the past, as you all know, with some of the neighboring programs. The closest that where this might be happening now is the program to the west of us, the Foothills program, which includes Alexander, Caldwell, and McDowell counties, lost Burke County this past July 1st to Catawba County. So Catawba and Burke are merging. They're actually in a management arrangement right now. The official merger will be July 1 of 2008. And so that exit by Burke County has left the Foothills program below 200,000 in population. So they are given 1 year by which they need to find a merger partner or have a 10% penalty per year added or subtracted from their appropriation. So they are looking, and they have expressed an interest in talking with us, but they've made no other overtures since that time. And I just put down here, too, the services and locations, which I think you probably all know, but I thought maybe since I only come once a year and give you a fiscal year report, it would be important just to state that. You know we have an office up on Highway 21 North. That's, of course, the county-owned property that we lease from the county. That is a comprehensive outpatient program. Also, you know about the Twin Oaks building that we have out near Twin Oaks Golf Course. That is a psychosocial rehabilitation program. Also, we have the Crisis and Recovery Center here in Statesville. And as you also know, this year we started operating out of the Iredell County Government Center South down in Mooresville, where we also have a comprehensive outpatient services, and then a whole list of other contract providers that are also here doing business. So now let me refer to this other item that I brought to you tonight. If you'll turn over past the map, what you'll see is the end of the year, although let me also give the caveat. Our finance officer says, now this is unaudited. You know how those finance officers can be. You want to make sure we get it right. Our auditors come in next week to begin our auditing process. But this is what we will report to our board next week as of the end of the fiscal year. I'll point out a couple of things. Excuse me. You'll see on the very bottom right, which is where I usually like to go as the chief executive, is what's the total gain or loss, and you see $107,000 was our gain for the year, which was very good. This was very much within our target. Last summer of '06, we sought out to make sure that we left very little public money on the table, but that we put public money to the community where services can be rendered and where it can help people. And there are programs that have saved a lot of money and put it in the bank, but we did not want to do that. We wanted to make sure that these services get there. So you will see that we've actually been making up a lot in the last couple of months, and that's due to how the business runs, where we actually might spend a lot on services, but the state doesn't reimburse us as swiftly as we might like to. So we were able to receive $1.5 million over our expenses for the month of June, and that'll be in the middle to the bottom right. I'm sorry, the middle of the page at the bottom. We see $1.570 million. So those are just a couple of things. You'll also notice that that under the expenditures part of the page, you'll see LME administration. That's where all of the management functions are, and then you'll see in contracted services, that's where the contracted services are also. If you want to turn over one more page, I've also got our state hospital admissions by county for you to see. This is important because Crossroads is measured and monitored on the use of state hospital services. The goal there is to use less of it, and I think you've read that in the newspaper many times. Our state is downsizing its state hospitals. It is closing two over in the central part of the state as it rebuilds a new replacement hospital that will be half the size of the two-bed capacities combined. So with all that going on, we have seen in our area the downsizing of Broughton Hospital. For example, on the admissions unit for adults, there's about 140 beds. And back 5 or 6 years ago, there were some 300 and some beds on that same unit. So it has been reduced quite a bit. You will likely hear about this periodically from all of us because it's very hard now to get patients into Broughton Hospital. And beginning every Friday from 11 o'clock in the morning until the following Monday, they're almost always full. So if somebody hits the emergency room, needs to be in the state hospital during the weekend, they'll almost always have to wait throughout the weekend if we can't find any other place. It's a very difficult thing for us and the patients and, of course, the county. That's the reason why we want to have those other local services here to help replace that. What you'll see is that outside of an extreme month, the month of September last year, where we had 26 admissions from Iredell County, it's largely got a pattern that's in the 15 to 20 admissions per month range, which is considered rather normal. However, we would like that to be somewhere down to around 10 or 12. That's the goal, and that's the idea that the state has, is that we shouldn't use too much more than that. So, and then last time I was with you 2 weeks ago, Commissioner Robertson asked me a question that I thought was very intriguing about detoxification services and about substance abuse services in general. So, and I was playing with him a while ago. I can answer a lot of things off the cuff, but when you get down in the level of detail, I need to do a little bit of research. So I decided that I'd add this as the icing on the cake for tonight, and then see if you have any questions, just to give you an idea of all the substance abuse services that we have here in Iredell County for citizens. These, again, if you're a citizen of Iredell County, you have these by contacting Crossroads. And you read this going from left to right as most intensive to least intensive. So what you'll see under the most intensive category is inpatient hospital detoxification. That's the most intensive, highest intensive type service that we can provide, medically managed detoxification. All the way over to the right where you see prevention, where we have a provider that's in both of our school systems here in Iredell County doing prevention when the school's in session for children and youth, both the elementary, middle school, and high school. That provider's name, by the way, is Insight, And they do the same thing for us up in Yadkin County, and they do the same thing in Surrey County. So they have a contract that does all three. They are based in Winston-Salem and are specialists in substance abuse services. You'll just see, I'll show you how to read this, under inpatient hospital detox, you'll see the hospitals that we have. Fry Regional Medical Center, I mentioned that last time. We have a contract with them. Broughton State Hospital in Morganton, we also send patients there. And the third item where you see ADATC, that's an acronym. I just couldn't spell it all out on there because it was so long. That's the Alcohol and Drug Abuse Treatment Center in Black Mountain. That serves our region as a state facility. They are building 30 beds for acute medical detoxification as we speak. They've already broken ground. They're going to be open in next spring of '08, and we will have access to those beds as well. Then you'll see medical non-hospital detox is the next column. We have a contract with Synergy in Wilkes County and also with ARCA in Forsyth County. And then moving one space to the right, short-term residential, a contract with ARCA in Forsyth, and then back to the Alcohol and Drug Abuse Treatment Center in Black Mountain. That is a short-term residential center. Then recovery houses, we actually have halfway houses here in the area. There's an Oxford house here we helped start several years ago. And then scattered leases, that we have 20 scattered leases where that Carolina Residential, which is our provider, rents apartments for people that are now approaching recovery in substance abuse, either as an individual or as a family, and we rent those apartments, and that lasts for up to a year. So it's called transitional housing, where that you can go into this housing and you can stay there for up to a year, but you have to work with your care providers to get out and mature out to the next level of care, which will be independent living. Mobile crisis management, you'll see that, and I've already described that as the next column. Intensive outpatient services, that's what the OP means. That's also provided here by Insight Human Services. They are operating down at the Mooresville office, and they operate over here on 21 North. And then outpatient services that are periodic, which means that intensive outpatient is at least 12 hours per week of care. And then periodic outpatient services is usually 1 hour per week or 1 hour for every other week. And that's usually reserved for people that are already recovering. It's the aftercare type services as you transition downward into this, and then you have prevention. And then I did put some numbers down there too, thinking about Mr. Robertson's question again, about the number of people that we provided detox to this last fiscal year here from Iredell County. And this is what we've paid for. If someone had insurance and we sent them to a hospital for detox, they weren't included here. This is where we wrote money out for public resources. 204 Iredell County citizens were involuntarily admitted to Broughton Hospital for that, and 25 of those 204 had a primary or secondary diagnosis of substance abuse. Then 47 Iredell County citizens were provided detoxification at Fry, Synergy, and ARCA. So that's how it breaks down just for Iredell County. And then there are people that don't need detox but may approach us and they need treatment, and then we put them in this whole continuum and let them go up and down however that they need. Okay, I've gone through a lot of paper, and I'm going to stop talking and see if you have any questions for me. Mr. Chairman, thanks.
Thank you, Mr. Warren. Do we have questions, Mr. Warren? Anyone? Thank you for coming.
I must have answered all of them.
Evidently. Thank you.
Thanks. It's been a pleasure as always.
Mr. Mashman, we'll call Mr. Mashman for administrative matters.
Mr. Chair, under administrative matters, we have the following under consent agenda. Approval of a request from the Fire Tax Board to allocate $377,000 to the Trinity Fire Department for their insurance rating reduction program. This is a reimbursement from the 1 cent tax set aside in capital reserve for the performance-based program. Item AA is a call for election on November the 6th for the proposed Troutman Fire District. Item B is approval of budget amendment number 8 for the acceptance of the 07-08 Justice Assistance Grant. Item C is approval to contract for a NC3 corridor study in partnership with Mooresville, Kannapolis, Mooresville, and Cabarrus County. I think that's correct. Item D is a tax department approval of the tax department's request for a contract to purchase software from Bytech. Item E is approval of the July 2007 tax releases and refunds. Item F is approval to apply for dental clinic funds from the Sisters of Mercy Foundation. Item G is approval of budget amendment for $16,793 for dental equipment. Item H is approval of an $8 intranasal oral vaccine fee. Item I is approval of a $10,000 budget amendment for participation in the North Carolina Public Health Foundation assessment regarding pandemic influenza preparedness. Item J is approval of the Health Department's request to amend their fee policy. Item K is a approval of a memorandum of understanding between the county and the Cooperative Extension Service. Item L is approval of the Building Code Inspector's career development as proposed by the Inspections Director. Item M is approval of a road agreement between the county and the State of North Carolina Department of Transportation for building a road to serve the Pratt Industries. Item N is approval of the August 7, 2007 minutes. Item O is approval of the funds availability form as requested by Mitchell Community College. And item P is approval of the burning ban as recommended by the County Fire Marshal. Mr. Chair, those are the items on consent agenda.
Thank you, Mr. Mashman. Do we have additions or corrections to the consent agenda? If not, do we have a motion to accept the consent agenda?
So moved.
Been moved. Are there any questions regarding the motion? All in favor of the motion say aye.
Aye.
Aye. Those opposed likewise. Ayes have it. Announcements of vacancies occurring on boards and commissions. Nursing Home Advisory Committee, one announcement. Appointments to boards and commissions. Moser Planning Board, ETJ, one appointment.
Mr. Chairman, I'd like to nominate Danny Martin.
Okay, Danny Martin. Do we have any additional nominations? If not, any questions regarding the nomination? All in favor of the nomination say aye.
Aye.
Aye. Ayes have it. Statesville Planning Board, ETJ, one appointment.
Mr. Chairman, I thought I had a nominee I was going to present tonight, but they backed out on me. I'll make a motion we postpone this appointment.
Okay, motion to postpone. Any questions regarding the motion? All in favor say aye.
Aye.
Aye. Ayes have it. Adult Care Home Community Advisory Committee, two appointments.
I'd like to nominate Dr. Johnny Elliott, please.
Dr. Elliott. Any additional names?
Move the nominations be closed, appoint Dr. Elliott by acclamation, and postpone the other two appointments until our next meeting.
Okay, all in favor of the motion say aye. Aye. Ayes have it. Nursing Home Advisory Committee, four appointments. Any motions on that one?
Mr. Chairman, I would nominate Linda Perrano.
Linda Moreno. Any
Perrano.
additional?
P-I-R-A-I-N-O.
Moreno? Okay. Any additional names? All in favor of Melinda Perrano, say aye.
Aye.
Those opposed likewise. Okay, we have three additional names. Motion to,
I move we postpone the other
okay,
nomination.
to postpone. All right. All in favor of that motion, say aye.
Aye.
Ayes have it. At this time, we have unfinished business.
Yes, Mr. Chair, and you should have before you now the correct findings of facts for that particular case. Not sure that there's any explanation as to the one that was presented earlier, but this was the one that was faxed, that was sent to me earlier for review and approval, and so it is presented to you at this time, and Ron Smith will go over that with you.
I apologize for the mix-up. I've submitted a copy of the findings of fact from case number 0703-1 submitted by McLean Farms, which was heard at the August 7th, 07 meeting. And the findings that you have in front of you have been developed based on the information that was submitted into evidence and which was sworn at the meeting, and the information has just been developed based on that testimony. And I'd be glad to answer any questions that you have about this, and then I would ask for your approval.
Okay. Do we have any questions, Mr. Smith? If not, do we have a motion?
Mr. Chairman, I move that we find these findings of fact in regard to case 0703-1 to be in order, and that we approve.
Okay. Any questions regarding the motion? All in favor of the motion say aye.
Aye.
Aye. Those opposed?
No.
Okay. Thank you, Ms. Smith. Okay, now we have public comment period. Do we have anyone signed up to speak tonight or wishes to speak? There's no one signed up. We'll move along to new business. Any new business? County Manager's report, Mr. Mashman.
Other than the written report that should be placed before you, two items very quickly. One is just a reminder of the mini retreat that has been set up for Thursday, September the 6th, beginning at 8 a.m., and calling your attention to the location of that retreat, which will be at the Spring Hill Suites and Marriott Conference Facility at Lake Norman and Moore Conference Rooms. And this is located at 121 Gateway Boulevard in Mooresville, which is at exit 33. You probably are familiar with that area in there. It's the facility that we'll be using. The purpose of the meeting, of course, is to continue discussions that were started during the winter planning session pertaining to growth management options. There will be a light breakfast that will be available at 7:30 and I will also remind you that the planning board has been invited to attend this as well. I'm not sure that all of them will be there, but we do anticipate several of them will be in attendance as well on this. The other item very quickly, and I think you already have this information, but it's just an update on the Neco prescription drug discount program. Just to make you aware that went into, those became available in May, and since May that we've actually, the month of May, of course, was a short month. We only had 25 that actually utilized that program. June we had 109, and in July we had 138. But the interesting part of that is that based on these statistics, the average savings per prescription is about 23 to 24%. So for a person that does not have insurance, being able to save 23 to 24% on their medical or on their drug prescription bills is well worth the effort to get one of these cards and use it. And they're still available. We've got them conveniently located at different places throughout the county, and especially in county offices, or they can call my office and we'll ensure that they get one. So again, I think the program is picking up steam as it goes along, and the savings are there.
Thank you, Mr. Mashman. At this time, we make a motion to go into closed session for property acquisition, GS 143-318.11, Section A, Item 5. That's the motion. All in favor of the motion, vote aye.
Aye.
Those opposed?